Hello, my name is Jarrett. I'm going to be your student physical therapist today. Can you tell me your name and date of birth?
Yeah, my name is Lexi the Best.
Okay.
I'm 40.
Okay. So can you tell me a little bit about what brings you in today?
Yeah, I have this back pain that won't go away. I've had it for years and years and years.
Okay.
I used to be in the military, and I guess through the VA, I got an MRI. It says I had a herniated disc, so I think that's why I've had all this pain. But recently now that I'm trying to play with my daughter and we play soccer together, it's just hurts. Before it was on my back. Now it goes down my legs.
Okay. How long has that been happening for?
Past 2 months.
2 months.
It goes down my leg, but this has been
Okay,
years.
yeah. So you've had the back pain for a long time,
Yeah.
but it's just going into your legs for the past couple months now.
Yeah.
Okay. How would you describe that pain into your legs?
No, it's sharp.
Okay.
I think it burns a little.
Does it ever get tingly? Like it kind of falls asleep or anything like that?
Sometimes, yeah.
Yeah. Can you kind of point to where that happens at?
It's all here.
All the way down?
Yeah.
Okay.
Yeah. Sometimes it's in my big toe.
Okay.
Yeah.
Yeah, we can check that out for sure.
Okay.
Have you noticed any weakness with any movements, or feel like you were not able to do anything that you used to be able to do?
Well, I'm getting older, I guess. So obviously I can't do what I was able to do in the military when I was 20, but maybe I guess so. Just a little less.
Okay.
Just I think the back pain really limits me,
Yeah. What did you do in the military?
I was a sergeant.
Oh, cool. That's awesome.
Yeah.
Well, thank you for your service.
Thank you.
Yeah. So what are some goals you have for therapy?
I just want to be able to play soccer with my kid. Before, my back pain was manageable. Now that it's going down my legs, it just gets in the way of me doing chores around the house, playing with my kid. Like I said, I just can't do as much as I used to.
Okay. Yeah, well, we'll definitely check that out and try and get you back and going. Okay.
Okay.
Just a couple quick questions we ask every patient to make sure they're appropriate for physical therapy. Have you had any fever recently?
No.
Okay. Any night sweats or anything like that?
No, I mean I do live in Florida. It's hot.
It is hot. Yeah, gotta love summer weather, right? Have you noticed any recent weight loss or weight gain? No. Okay. What about any bowel and bladder dysfunction?
No.
Okay. I think that's about all the questions I have for you, and we'll kind of go into some tests and measures from there.
Okay.
All right. So for lumbar radiculopathy with radiating pain, typically for the epidemiology, it's more men than women, and the highest prevalence is in ages 45 to 64. However, there is a high prevalence in women in the military that was cited in 2 different articles. This can be secondary to individuals with disc herniations, facet or ligamentous hypertrophy, spondylolisthesis, infections, neoplastic conditions, and vascular disease. So you kind of need to see from your questions if you need to refer out for any of those things as well. Subjectively, they'll have electric, burning, or sharp pain in the low back and lower extremities. They might have some lower extremity numbness or paresthesias as well, and lower extremity weakness. So now we're going to go into different tests and measures. So first, if we just want to look at some posture, if you want to go and stand up, I'll just kind of see how your posture is. Good. Can you turn that way for me?
Yeah.
Thank you. Okay, and I'm going to come on that other side as well. Okay. Okay, you go ahead and have a seat, okay? Next thing we're going to do is we're just going to check some sensation and some strength in your legs, okay? So I'm going to just be touching both sides of your leg, and we're going to just see if that feels the same or if it feels different, or if you can feel it, if you can't feel it, stuff like that, okay? So I'm going to do it to the side just so that our examiners can see as well. So does this feel the same as this? Yeah. Does this feel the same as this?
It's less. I
Less.
think.
Okay.
Yeah.
On both, or which one was
both?
Both?
Yeah.
Then the one before.
Yeah.
Okay. Does this feel the same as this?
It's less.
Less?
Yeah.
Does this feel the same as that? Okay. What about here?
Same thing.
Less?
Yeah.
Okay. What about here?
Also less.
Okay. Can you take your shoes off for me real quick so we can check your, I know you said it was going down into your toe, right?
Yeah, it is.
Okay. So what about here?
Definitely.
You can't feel that, or?
A little bit. It's
okay. But less than when we were. Okay.
Yeah.
What about here?
Yeah,
less. Okay. All right. Next thing we do is just check some strength. So try and bring this knee up towards the ceiling for me. Okay. And don't let me push it down.
Okay.
Okay. Let's do the other side. Okay. Now I want you to kick your leg out, straighten that leg, and then just bend it just a little bit. Don't let me push you that way. Okay. And then we'll do that on the side.
Oh, can't do that like I used to. I
Yeah.
used to be so strong.
Oh, that's okay. We're gonna next bring your toes up to the ceiling.
Okay.
So bring them up if you can. Don't let me push you down. Okay. That was strong.
I mean, not like before.
Yeah, that was pretty good though. Okay.
Yeah.
Okay. All right. So we checked those. So next, we're just gonna have you lay on your back if that's okay.
Okay.
And we'll do one quick test. This will be the straight leg raise test. So just like it sounds, I'm just gonna lift your leg up. Let me know if you feel anything.
Okay.
If it's what the pain you came in with as well, okay?
Mhm.
So I'm just gonna bring your leg up. You feel anything?
No, that's not it.
How does it? I'll go a little bit down. Is it okay there?
Yeah, that's good.
How did that feel?
It felt like burning.
Okay.
Like down the back of my leg.
Is that what you? The reason you came in today? Is that your pain?
Yeah.
Okay. Now I'm gonna move your foot a little bit. Let me know if that feels the same as it did a second ago. Okay.
Oh yeah.
Yeah.
Mhm.
What about if you bring your head up? You feel that too?
Yeah.
Okay. Go ahead and relax. We're just gonna do that on the other side as well. Okay.
Okay. Do you want me to flip over?
Yeah, that's okay. We'll just do it here. Okay, so
Yeah.
I'll go back out of that. So let me know if you feel that again when I move your foot.
Mhm.
Feel it?
Mhm.
Okay, I'll relax. What about if you bring your head up?
Yeah.
Yeah, okay, relax. Good. Okay, you can go ahead and have a seat. So the last thing we're gonna check real quick is just your reflexes. You know, when they hit your little
Yeah.
patella, your little bone
Yeah,
on
they
your
used to
knee.
do that. But
Yeah, they do that at the
army.
doctor
Yeah.
every year, right? Yeah. So let's go ahead and check that as well, okay?
Mhm.
So can you sit where your leg isn't on the ground? I know this isn't super. Yeah, so we're gonna pretend this is higher up.
Yeah.
And I'm just gonna do this and we'll see how it is. Okay. So a little bit less than, did it used to be more than that? Or is that about
I think
normal?
so. I mean, that
Okay.
doesn't look like a whole lot.
Yeah, so it used to be more when
Mhm.
you go to the doctor. Okay. We'll try and decide too. Okay.
Yeah.
So-
a little less.
A little less than normal.
I think so.
Okay, I'm gonna check the one at your ankle too, okay?
Mhm.
So I'm just gonna bring your foot up here and I'm gonna check here.
That was a little less.
Less?
Yeah.
Okay. And let's check it on the other side. So that was less as well, right?
Mhm.
Okay. So objectively, with the lumbar radiculopathy with radiating pain, they're gonna have sensory loss in a dermatomal pattern and motor loss in a myotomal pattern. So it looks like more than one level was being affected in this individual. They will also have positive straight leg raise testing, which was positive bilaterally, and they will have positive deep tendon reflex testing, which was less at both the patella and Achilles reflex. There is no key diagnostic feature, so you have to really take all of the objective and subjective information and kind of just come to a decision from that and kind of make sure it's nothing else. Depending on some other questions they might ask, I might ask about, it could be due to secondary mechanisms like infection, cancer, stuff like that. So it's really important to ask those red flag questions because this could be something we can treat, but we also might need to refer due to the primary mechanism for this presentation as necessary.